Good evening, everybody. I'm Reverend Liz Walker, pastor of Roxbury Presbyterian Church, and I welcome you all to Where Do We Go From Here? Coping in the Next Season of COVID-19. More than 2,000 of you registered for this special community conversation about the pandemic with Dr. Anthony Fauci, and that is critical because we need as many facts as possible. That's our goal tonight. But first, if you've lost someone to COVID, or if you're struggling with COVID right now, or you know someone else who's struggling, we want you to know you are in our hearts, we care about you, and we are praying for you. And now to the good news. 3 drug companies, Pfizer, Moderna, and AstraZeneca, have announced vaccines that are very effective, they say, to meet this challenge. But there is a greater challenge. Many people are resistant to taking the vaccine, and the pandemic continues to spread at alarming levels. Tonight, we're going to talk about all of that with our special guest, Reverend Dr. Gloria-White Hammond, who is the co-pastor of Bethel AME Church here in Boston. She's a pediatrician and a member of the Mayor's Task Force on Healthcare Equities. And from Washington, D.C., our special guest, Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. Now, we have plenty we want to ask Dr. Fauci, and he's got a limited amount of time. But before we get to that, I've got 2 other pieces of business I want to take care of. First of all, if I had to choose one word to describe the last 7 months all over the world, I would use the word trauma. The whole world has been traumatized, the loss of life, the loss of normalcy, the loss of connection, and we're all trying to figure out how to cope. Helping people cope is one of the main ministries of Roxbury Presbyterian Church. That's why we're here tonight. The Corey Johnson Program for Post-Traumatic Healing was started in 2014 as a way to help our community cope with violence. Take a quick look at the work we do.
My community, it's a war zone. There's always cops flying down the street. There's always a crime scene going on.
I helped my next door neighbor bury her son who was murdered in Walgreens parking lot, and they've threatened to kill my child at least 9 times.
I was raped by a Catholic priest.
When the phone was ringing, I picked it up, and the other voice said, "You better get to Brigham and Women because Corey has been shot." I think I knew right away that he was gone. But it was a kind of numb feeling.
What I've learned about trauma is if you hold it in, it consumes you. It takes your body over.
Come find your mercy.
Love, support, consistency, and safety.
We are trying to create a platform for young men to be able to talk about their pain, their fears, and what is going on, and so that they can begin to have a place to share how they feel.
So when Doug reached out to me, I was immediately enlightened and in tune with him that we should indeed pursue this, because I think that folks in my town in Chattanooga and beyond really need to speak to one another, listen to one another. And sometimes we can feel alone as an individual, we can feel alone in our neighborhoods, and we can feel alone in our cities, that this struggle is just our struggle. But it isn't just a struggle of Chattanooga. It isn't just a Southern struggle. It isn't simply the struggle of Boston. It is a national struggle for freedom and justice and healing.
I think that it's going to be okay. I really feel that.
So we want to know if we have a reason for any optimism when it comes to this COVID-19 pandemic. Let's go right to our panelists right now, Dr. White Hammond and Dr. Fauci. Again, thanks for joining us. First question to you, Dr. Fauci. We're so glad you're here. I have read, contrary to what we just saw on our poll, that as many as 40% of this country well, actually, that kind of sticks with our poll, is resistant to taking this vaccine. But I am pretty sure that people in my community, which is a poorer community, a marginalized community, a disenfranchised community, and a community that is disproportionately represented by COVID victims, I know those numbers are higher in my community. So what do you say to these people? How are you persuading people to take these vaccines?
Well, thank you for having me here. It's a real pleasure to be with you. I think what one needs to do is to try and find out what the reason that they are reluctant to get vaccinated. Is it a broad, generic reason, a distrust of the medical establishment because of the history of the abuse, particularly of the African-American community, with things that date back as far as Tuskegee and Henrietta Lacks issues? Or is it something about the process of the speed with which this vaccine was developed and somewhat of the mixed signals that one has been getting in this divisive society from Washington? So you can address each of these. First of all, it's important to understand that the process of the development of a vaccine and the decision as to whether or not it's safe and effective is a process that is independent of the federal government and independent of people who might have a vested interest, like the pharmaceutical company. Let me explain. When we have the trials that you just referred to that have showed a high degree of efficacy, between 90 and 95% in 3 separate vaccine trials from 3 separate companies, the determination as to whether or not it's safe and effective is made by an independent body, what's called a Data and Safety Monitoring Board, which monitor the trial. And when you reach a point when there's information to indicate that it is truly safe and effective, they are the only ones that initially have access to that. So the company or the government can't try and manipulate it to its own advantage. It's an independent group. When that independent group determines that the vaccine is safe and effective, they make that information known to the company, which then takes that data and gives it to the independent scientists of the Food and Drug Administration, the career scientists, not politicians, not people who might have a vested interest. Those people examine the data very carefully and then work with their own advisory committee, which is yet again another independent body that doesn't have to answer to anyone. They then look at it and make the recommendation to go ahead and have the FDA go for what's called an emergency use authorization or a full biological license application approval. So what you're having is both independence and transparency. And at the end of the day, all of those data become public because they will be published in peer-reviewed journals. So the process is a sound process. Number 2, the speed with which it's been done does not compromise safety, nor does it compromise scientific integrity. It's the exquisite nature of the breathtaking scientific advances that have occurred over the last decade or so that have allowed us to do things in weeks to months that formerly took years. So you should not be intimidated by how fast it was done and say it was done so fast it can't be safe. The safety issues were primary in everyone's mind during the testing of this vaccine. And note that we're not even allowed to apply for use of it until 60 days past the time that half the people got their last dose. So we know that safety is paramount. Having said that, we are fortunate that we have now 3, and we likely have more than 3, vaccines that are extraordinarily effective in preventing disease and serious disease. And since minority communities, particularly African Americans and Latinx, elderly individuals, those with underlying conditions, those who have suffered most from this terrible outbreak, are the ones that stand to benefit the most. So they are the ones to get vaccinated, not only for their own personal benefit, so that we can have a blanket of protection over the entire community. Because the more people that get vaccinated, if you have a highly effective vaccine and the overwhelming majority of people get vaccinated, we can crush this outbreak the same way vaccinations have crushed smallpox and polio and measles. It's the same thing.
Quick follow before Reverend Gloria has her question. If the vaccine was available to you today, would you take it, Dr. Fauci?
Based on the data and based on the FDA's recommendation, I would wait for my turn and I would definitely take it. And I would advise and recommend to my own family to take it.
Thank you very much. Reverend Gloria?
Sure. Thank you so much, Dr. Fauci. It's a pleasure to have you with us today. I have heard you reference this blanket of protection, and it's certainly a beautiful metaphor. But help us, what is this blanket of protection?
Sure.
And how do we get it?
Okay, that's called herd immunity. And what that means, when the overwhelming majority of the population is protected by vaccine or having been infected and recovered so that they're now protected, when the virus enters into a community, it has no place to go because there are not a lot of susceptible people. The more susceptible people are, the more momentum the virus gets to spread. If everyone or almost everyone is protected, you have what's called this blanket of herd immunity. You know what it really, as sort of the metaphor comes from? You know, you see the pictures when you look at films about Africa, when you have the wildebeests and the gazelles and everyone, and you see the lions or the predatory animals trying to get them, and you have the weak ones, the elderly or the young ones that are there. What does the herd do? If all of the strong herd stick together, they protect the vulnerable, because in the case of the metaphor, the predators that are trying to hurt you never get to you because you have this blanket of protection. If you have the overwhelming majority of the community is already protected because you're vaccinated, then vulnerable people who might not make a good response, who are sick and can't get vaccinated, they are protected because the community is protected. So you really have a responsibility to yourself and a societal and community responsibility to be part of this broad protection.
So I have a follow-up question to that. As you know, communities of color have suffered disproportionately with regard to this disease. So for example, in Boston, African Americans, 25% of the population, 34% of the deaths. So does that mean, in terms of the percentage of people who get vaccinated, does that mean that should we have a higher percentage of people who get vaccinated than the percentages in white communities, for example?
I believe that both white community and African Americans and Latinx should have as high a proportion as you possibly can. One thing that's an excellent entry into an important issue, we want to get more African American and Latinx, as well as Native American and Alaskan Natives, into the clinical trial, because we want to be able to say in the actual trial that proves that a vaccine is safe and effective, we can look our African American and our Latinx colleagues in the eye and say, you know what? We've proven that it is not only safe and effective in whites, it's safe and effective in you and your community. And that's the reason why we encourage members of the African American and Latinx community to volunteer for the clinical trials when it is in your area, so that you could be part of this process of proving that it actually works.
Dr. Fauci, one of the things that is confusing is that despite the rising infections, there seem to be lowered death rates. I think that is correct. And so that a lot of people are thinking, well, that means we're out of the woods because people aren't dying like they used to be dying. First of all, is that true?
No. So there's a difference between death rate and number of deaths. If you have many, many millions of infections and still a lot of people die, the rate may still be low. Whereas if you have few infections and the same number of people die, the rate is high. So don't be fooled by saying the rate is down. We now have between 1,000 and 2,000 deaths literally every day. Sometimes it goes down to 800, sometimes it's 1,500, but we still have a lot of people dying. You know what the number you need to focus on? There have been 250,000 deaths from COVID-19 in literally 9 or 10 months. If we don't stop the spread of this infection, there will be more hospitalizations, more intensive care, more deaths. Now, the critical issue is that even though you're saying the rates of death are lower, we're getting younger people getting infected. We're also doing better at taking care of people. But that's not an excuse to just say, well, who cares? Let more people get infected. If we don't stop this outbreak, we will have an extraordinarily large number of deaths. That's the reason why vaccines are so important. We want you to abide by public health measures, uniform wearing of masks, avoiding crowds in congregate settings, keep physical distancing, doing things outdoors preferentially to indoors, washing your hands as frequently as you can. If you combine those public health measures with the advantage of a vaccine that will soon be with us, we can put an end to this outbreak.
I have another question really quickly. We're receiving tons of questions from our audience about long-term side effects of the vaccine. Can you answer that? Is it too soon to know what the long-term effects will be of the side effects?
Well, there are three aspects of that, and I'll quickly answer it. There's the immediate, namely you get injected, and you get a sore arm. Some people get an ache. Some people feel poorly for a day, get a fever. That goes away almost invariably in 24 hours. Then there's the intermediate, something that might happen, a week or 2 or 3 later. That's what we're looking at in the clinical trial, and we have not seen any severe adverse events that we could relate to the vaccine thus far. Then there are the longer term effects. Now, when you look at the history of vaccinology, about 90+% of events that are severe occur between 30 and 45 days following the vaccination. And for that reason, before the FDA will apply for an emergency use authorization, they will wait 60 days from the time the person, half the people got their last dose. So they're not even going to be looking at giving the vaccine to anyone until you have a 60-day period where there were no adverse events. 60 days, within 60 days, almost all the historical adverse events that were more long-term occurred. So safety is a very important issue. There's nothing that one can do in an intervention medically where there's some possibility of an adverse event. But when you look at the hundreds and hundreds of millions of people who've been vaccinated, the long-term adverse events have been less than minuscule in the big picture of the protection that you get from a vaccine.
Dr. Fauci, as you know, there are different vaccines. Some vaccines can give you immunity for forever. And then for others, like the flu vaccine, every year we get another vaccine. Do we know what will be the duration for these vaccines?
We do not know because we haven't had enough time. Remember, we've only been in this for less than a year, and vaccinations will be starting to be given in December and then through the first and second and third quarter of 2021. We will be following that closely. We do not know how long the durability of the immunity is, but let us assume, which it likely will not be lifelong. It likely will not be as long as measles. But if it's long enough to get us through this pandemic, then it is conceivable that we may want to every year or 2 or 3 come back and boost someone. But the challenge now is to end this pandemic. And we feel fairly confident that the durability would be at least enough to put the lid on this outbreak. If we have to give boosters later on, so be it. That's not the worst thing.
One of our city councilors had this question for you. Andrea Campbell says, with all the promising reports about the vaccine, do we just assume, Dr. Fauci, that early vaccination preference will be given to communities and demographics hardest hit? Is that already an assumption, or are people working on that now?
That's a very good question. What will happen is that when the companies get their EUA, the organization that's responsible for the prioritization is the CDC, the Centers for Disease Control and Prevention. And they do that in close advice from the Advisory Committee on Immunization Practices. But when vaccine gets distributed from the companies where the warehouses and they go out to different parts, locally, the local health departments will be given the prioritization of how you would best distribute the vaccine. Likely, if it acts like it does historically, healthcare providers who put themselves at a daily risk of getting infected will be high up in that priority, as will the elderly and those with underlying conditions. It hasn't been finally determined yet because the EUAs have not been granted. But when they are, the CDC will make that determination.
This question came in from a member of our church who had three family members who had COVID. And he wants to know if those family members should get the vaccine. They survived COVID, but should they take the vaccine if it's made available?
If one of the recommendations is that people who are in a high-risk category and who have been infected should get the vaccine, they should get it. I would imagine that an individual who is infected and recovered, you don't know whether they're still at risk. So I would say that I don't know what the priority would be, but they should ultimately get vaccinated.
I have one final burning question, Dr. Fauci. I've certainly been impressed with your intellect and inspired by your integrity. The intriguing question for me is that over the last 8-9 months, we have seen from day to day, you've been buked, you've been scorned, you've been talked about, sure as you're born. And inevitably, you managed to stay cool, calm, and clear. How do you cope in the midst of all of this? What are the resources you turn to keep you clothed in your right mind?
Well, there are two things. One is I have developed the ability to focus like a laser beam on what my responsibility is to protect the health and the safety of the American people. And indirectly by doing that, the health and the safety of the rest of the world. So when you focus on that, you really get a bit of energy. That is complemented by another very special source I have, and that's a wife who is extraordinary, who understands me, who supports me, and when I have that, everything else that challenges me seems almost trivial.
What do you do when you are having those moments that kind of go, gosh, I just can't take any more of this? Or do you even have those ever?
I do, but sometimes the thing that I relieve stress is I've always been a runner. So I go out and I'm getting a little bit too old to run as much as I do. So I do power walking. I love being outside. I don't get a chance to do that, except quite frankly, I likely will be doing it after my next Zoom, which is in a couple of minutes, sometimes late tonight. And I do that with my wife. And she's, as I mentioned, keeps me sane. She's the anchor and the rock in what I do.
That is really great. Well, we are so just blessed to have you, Dr. Fauci. If you just have any parting words for our community, we have probably 2 minutes. They said you had a hard 59 out. So I just wanted to give you 2 minutes to kind of sum up your appeal to our community to take this vaccine.
Yeah, I, over the last almost a year, have witnessed the disproportionate suffering that your community has gone through. It is something that is really extraordinarily unfortunate. And the reasons for that, I do hope when this is all over, we address, namely the social determinants of health and the inequities that you've been faced with essentially forever. So that's the first thing. I totally understand what you've been through, and I plead with you that we as a community, your community, the community that we all live in, can do something about this if we abide by the public health measures and get vaccinated. Don't deprive yourself of the advantage of an extraordinarily important advance in science by not getting vaccinated. Protect yourselves, your family, and your community.
But Gloria, first of all, I wanted to talk about what you do, because I want people to understand that we're not just two old friends who went to Sudan 100 years ago and built a friendship. You are on the mayor's task force for healthcare inequities. Am I getting that right?
That's right, to address inequities. Initially, that committee was formed initially in the wake of COVID-19. And of course, as we continue to see more and more disparities and began to understand the origins of those disparities and the extent to which they're very much informed by what Dr. Fauci referred to as the social determinants of health, the places that are often victimized in terms of where we live, where we work, where we play. And that we recognized that we needed to look not just for the moment in terms of addressing the acute crisis, but look more deeply at the root of the crisis. And so I'm on that committee, and that's Mayor Walsh's committee.
Thank you so much for joining us.
Thank you very much, Reverend Walker, and it's awesome to be with you. And I want to thank you for having me here tonight. I also want to thank Reverend Gloria-White Hammond for your amazing work as well. Thank you. And thank Dr. Fauci. I know he's not here anymore, but I want to thank him for what he's done all for our country and giving us a lot of peace and serenity, if you will, during a very difficult time. I just want to also acknowledge anyone on the call, anyone in this Zoom who lost a loved one to COVID-19. You are in our thoughts and prayers as we move forward here. In the beginning of the pandemic, what we noticed very early on, and I referenced a little bit about the Latino community now, but what we noticed early on was roughly 44% of all of our cases were in African-American Black community. And we realized that there was a big inequities when it came to healthcare and also a mistrust in healthcare. So we formed the COVID-19 Health Inequities Task Force because we knew that existing inequities in healthcare and our workforce would cause COVID to hit the Black and brown community harder, and it was hitting them harder. The task force is comprised of people who are known and trusted in the community, including Dr. White Hammond, who has been very engaged and involved in this. In this work, we have been proactive and intentional about equity. We have to be willing to see what is working and what is not, reaching out to those who are most in need and most in need of support. That's what we've been doing with the task force. We're among the first cities to release the COVID-19 data by race and ethnicity. That's something that wasn't happening in the very beginning of the pandemic. Getting those facts out were very important in transparent ways to explain to people, and it helped lead our response with investments in testing at our community health centers. We began those investments in our community with the greatest health inequities, both historically and in COVID data. Every week, the task force is looking at data on cases and deaths by each neighborhood to better understand the gaps that are out there. And we need to be more intentional about what the need is. And they're helping us guide us in this crisis right now. The task force has also guided key partnerships and investments, in particular in communities like our immigrant COVID collaboration and our investments in the Greater Boston Latino Network. And now the Resiliency Fund is also investing in the Black Boston COVID-19 Coalition. So we're making those investments. The Resiliency Fund, which we created, which was all raised privately, we've distributed over $29 million into communities hit the hardest. The grantees are 54% of them are led by people of color. The task force is now a key contributor to our work on treating racism as a public health crisis. We're doing this work in partnership with Boston's healthcare sector, and we're funding it with money shifted from the police overtime budget. So this is all what came out of COVID-19 when we enter this. But we need to continue the work. And we also, when we think about, and I'm not sure if Dr. Fauci talked about this, when we think about a vaccine, and Reverend Walker and Reverend White Hammond, you know this, we need to make sure that people understand the importance of trusting the medical profession. And we need to get people vaccinated. We need to get people tested. And we also need to, quite honestly, deal with healthcare in a whole different manner in our country. But we're here in Boston, so we have to deal with healthcare in a whole different manner. Trust has to come back into the healthcare system, particularly in our communities of color, particularly in our Black and Latino community.
Thank you both. We still have a few minutes, but I wanted to take the last few minutes to just talk about whatever gives you hope, what gives you optimism, what you'd like to leave our audience with, what you'd like to leave the city of Boston with, the region, people who are looking in on this Zoom call to get through. So this is about how we're going to get through this next season.
What gives me hope is people watching just acts of kindness throughout this very difficult time. The last 3 years in our city and our country have been difficult. It's been difficult for a whole host of different people, and watching people step up on large scales, whether it was a women's march or fighting for immigrant rights, fighting, for equality, fighting against racism, fighting to feed people, that gives me hope. And I would just suggest to everyone, sometimes we all have overwhelming feelings, including myself. It's a day at a time. It's literally a day at a time. And it's now 7:57. And what I need to do is get to next couple hours, go to bed, go to sleep, wake up, and try and do something positive for somebody tomorrow. But I can't worry about tomorrow because it's not here yet. And I can't worry about yesterday because it's past. You can only worry about the present moment. So I just ask people to take life a day at a time.
Yeah, I would say something along the same line, that in the midst of it, I've been so encouraged by people's resilience. And when this all started, I never would have anticipated that we would still be here. And but we are. And even as people work through the challenges, the frustrations, the fears, the disappointments, the anxiety, we are still here so there's a resilience in the midst of that, and that gives me encouragement. And that's who we are, and that's what we do. And I thank God for God's faithfulness and the ways that faithfulness shows up in the context of community. My wonderful husband and you all and those who make up my beloved community of Boston.
Well, again, I want to thank you both for joining us tonight, because this was a great conversation. I think that I hope we've given you, the viewer, something to think about. I hope we've given you some specific information about COVID. If you have any other questions or you want to stay in touch with me, I just want to make sure that you know you can reach me on Twitter at @LizWalker1, or you can reach me on Instagram at Pastor Liz with 2 Z's. So that's really, really very, very, very important. I also want you to know that the Corey Johnson program has a weekly conversation on Zoom about trauma. And all you have to do to find out about that is go on to our website, rpcsocialimpactctr.org, rpcsocialimpactctr.org. And that will give you the Zoom line number. Every Thursday night, we talk about all the pain that we have. We talk about our own vulnerabilities. It's a safe space. We talk about race sometimes. We believe that talking about it is one thing we can do to help each other. As the mayor said, to listen and to talk. It is really important. So please join us for that. We want to thank our partners for helping us with this conversation tonight. This was not just Judell Cummins and Reverend Liz Walker. This was Boston Medical Center, who's been wonderful, Bethel AME Church, Reverend Gloria's Church, Massachusetts General Hospital, the Massachusetts Health Council, and our beloved Boston Red Sox. We are actually broadcasting this Zoom because of the strength of their Wi-Fi from Fenway. So that's our kind of our point of origin tonight. They have been so kind to us. And so we want to thank you all for helping us. This is about a community that's working together. If you have any questions, get in contact with us. Take care of yourself. Wear the mask no matter what. Stay distanced no matter what. And please never forget that you matter. You absolutely matter. We care about you. Reverend Gloria, because this is our event and nobody else's, we can end this bad boy in prayer. Would you pray us out?
Absolutely. God, we are in this midst of all that is swirling around us. We are so grateful. We thank you for being God. We thank you for the grace to face the future with less fear and more faith. And we remain confident of this, that the God that we serve, working among us, God, and with this community, can do anything but fail. And it is to your name we pray. Amen.
Amen. Good night, everybody. Be safe. Wear that mask.